and then I'll go to, where I'd go from here and then where I'd finish up. So this is, again, I have the disperser pad, somewhere on the, mid thoracic spine. I have two capacitive electrodes on the back four, and I'm working both sides of the neck, just trying to, warm up the traps, warm up the SCMs and that kind of stuff before we try and start to, mobilize a little bit more, get them moving, right? Anyone who's heard me talk on these knows I love using the tech car, with movement and stuff like that. So here you go. And I just want to highlight the parameters I'm using here. So you can see I'm in the capacitive. I have the boost going, which is really going to blast that current. You're going to get a real nice thermal effect there, enhance vascular benefits, collagen synthesis, all that good stuff. But I'm moving it throughout her, both lateral sides for neck. We'll just play that again really quickly. And because I'm working pretty high, at a high level of heat, I'm moving those applicators relatively quickly. The way I structure my treatments is I typically like to start high, work my way back down low. The idea being that you really get those enhanced cellular benefits, the vascularization, enhanced vascularization, the collagen synthesis at those higher level. So I'm feel comfortable with where I'm at using the Winback to start, at a higher level of heat and then work my way back down from there. So once we follow that up, you'll see my next video here. I am going to drop that heat down pretty low compared to where I had been working at. And this is because I want to now get her to start moving a little bit. So let me play this one. So you see my applicators are more fixed than they are in the original video, but now I'm just having her do gentle rotation. The thing that I love about the Winback is we can make previously painful movements not painful. It kind of goes back to what Dr. Tucker was saying before. Like if we can eliminate discomfort for even an hour or two, we know we're in the right ballpark. So you see, I'm just kind of moving the applicators with her head, just trying to get a little bit of cervical rotation while she has that thermal effect going. But you'll see here that now I'm working low pulse, so that's going to reduce the thermal effect. I only have about 30% heat, okay? It's important to know that when we're working with the capacitive current, right, that is going to hold the current more in the superficial muscle tissue. I think it's, so with that, tissue is going to heat faster, right? So I drop it down low. I still want to get that current targeted in the SCMs, those the rotators of the cervical spine. But I'm doing it in a way that is safer for the patient and feels more comfortable. And then from here, what I will follow that up with is something more, share this last one. So utilizing the bracelets and trying to really dig in there. So after we've warmed it up a little bit, now I'm, really trying to get in there, mobilize that soft tissue with my hands. You could see my intensity is now back up higher. Another thing that I've talked about on these calls before is the utilization of using the bracelets with gloves and without. And I think this is a super important thing for people to understand is when we utilize the gloves, it's really going to make that current mimic a capacitive current. So we have a resistive current traveling through the bracelets. That using a glove kind of insulates that current, allows it to be honed more in the soft muscular tissue. Play this one more time for you guys. Compared to if we were just using the bracelets without it. So if my goal was to target, let's say, ligamentous or bony tissue, then I'd probably be doing this with the gloves off. But again, the goal was to relieve the tension. I mean, real palpable tension in the upper traps and the SCM. I even came up a little bit into her suboccipitals. We did a nice release with that. Keeping the disperser pad in the exact same position on that, upper to mid thoracic spine. But yeah, I love utilizing the gloves for that reason, because especially when we're doing soft tissue work, you can get all the benefits of the hands-on work while you're utilizing the tech car current and really hone that muscle tissue, the current in the muscular tissue. And